Hey ladies, welcome to Wellness Wednesday. Sorry, we've had some technical issues. Apparently, Facebook wants to block me for some reason. I don't know why, but we'll make it work nonetheless. So it's nice to be with you again for Wellness Wednesday. As I promised, we're going to go through and answer tons of your questions tonight. Before I get into that, I will say my disclaimer quickly. Anything that I do say and share with you during tonight's Wellness Wednesday is health information and not to be considered health advice. Do not stop taking, or change the way you're taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so they can help you make those changes appropriately and safely. And as far as attending this Wellness Wednesday, this does not establish a doctor-patient relationship. So let's get into it, lady. Again, I need to remind you, I've got tons and tons of questions covering many topics that I hope to be able to get to tonight. Next week, I plan to do a deep dive into Hashimoto's for you, which I am going to cover a few things related to Hashimoto's tonight, but we'll do a deeper dive next week. All right, so the first question I'm going to start with, Linda asks, can heart disease be reversed if caused by Hashimoto's disease? Now, I'm not aware of Hashimoto's itself causing any sort of heart disease. Now, in a roundabout way, Hashimoto's, as we know, damages the thyroid. Thyroid is the victim when there's Hashimoto's. It's the, this is an immune system disease. And so we see damage done to the thyroid. That lower thyroid function resulting from that damage certainly can cause issues with any organ, because every cell in our bodies needs thyroid hormone to function properly. So in that sense, it's not necessarily caused by Hashimoto's, it's caused by the low thyroid that's resulting, from Hashimoto's. But the heart is, it's one of those organs that is, do I believe we have the ability to heal? Absolutely. If you've gotten to the point where you're dealing with pretty severe heart disease, whether it's heart failure, which is really what I'm talking about, heart failure and arrhythmias, like atrial fibrillation or just, heart block and other forms of chronic heart disease, they're going to be very slow. They're going to be slow. And you're likely then taking medications to kind of keep things going, keep your heart going, and so forth. But I would say have faith and do everything you need to do to slow down the Hashimoto's with our plan, our blueprint, and then allow for that extra time that you might have to heal. So that's where I'm at with that. Marcia asks, can I accomplish anything when my thyroid is dead? It is smaller than a pea. I take 150 Synthroid. So, Marcia, for you and anybody else that is lacking your thyroid gland or who's had a thyroid ablation where they've killed your thyroid, where you've had it removed, or Hashimoto's simply has just, caused it to almost vanish, like in this case, Marcia's case. That's why you have to take thyroid replacement hormone. Because what did I say earlier? Every single cell needs thyroid hormone to function. And you need your cells to function so that you function. All your systems and organs and tissues and so forth. So, yes, you can accomplish something. Now, as a caveat, many times taking Synthroid and other synthetic forms of thyroid replacement isn't helpful, right? Your body doesn't use it very well, or your liver doesn't convert it very well, convert the T4 to T3. So this is certainly problematic, and a lot of you just are taking the medication, don't know why you still don't feel well, don't know why you can't lose weight, don't know why you still have the brain fog, trouble sleeping, all these things. all right? So we need to figure out by comprehensive testing what is behind your body not utilizing this synthetic hormone. Maybe you would do better with a natural desiccated thyroid replacement, okay? Maybe you have inflammation caused by so many other things that is preventing your body from utilizing your liver, from converting T4 to T3, right? There are many different scenarios, over 22 different patterns of hypothyroidism, if you really get down to it, after checking all the appropriate thyroid markers. Heidi asks, I've been told I have the beginnings of cataracts. Will working through this program help reduce, eliminate, or stop the growth of them? Also, will this help eliminate my tinnitus? Sometimes it is so loud and distracting, right? These are two symptoms, two things that certainly they're resulting from a high degree of degeneration, okay? When it comes to cataracts, there are multiple causes. I know that diabetes causes them. I know that parasites can cause them. We know that mold toxins that affect the nervous system can cause them. Let me just share a fun success story. So Ida was one of our patients, and she had type 2 diabetes. She had Hashimoto's, okay? Overweight for sure, obesity, and was struggling, right, with heart issues. Well, she also had developed cataracts and was set to have cataract surgery at some point through the middle of her program. And turns out, as she was going through, she started reversing things. She started feeling better. She started releasing some weight, started getting a little more energy. She went back to her eye doctor for a checkup. It was, I believe it was getting close to her having her pre-operative checkup. And her eye doctor just kind of looked at her and said, you don't need to have surgery anymore. Like, I don't see the cataracts. So be that, it's pretty remarkable, right? She was dealing with and addressing all of the appropriate triggers that we found. Okay, all of the triggers that we found that were fueling the autoimmune fire, including the insulin resistance that was fueling the fire too, which had developed into type 2 diabetes for her. And her cataracts went away. Okay, she was treated for parasites. She was treated for other toxins, for mold toxins. So that's pretty fun. Anyway, as far as tinnitus, this can have, again, multiple causes. This generally has a basis in too much swelling around your otic nerve, okay, the nerve that helps control your hearing. And when you have swelling around this, it just, it kind of squeezes it and pinches it, and it causes the tinnitus. This can be caused by infections. So virus infections. This can be caused by certain parasites, especially strongyloides or threadworm. This can be caused by allergies, but those are usually mediated by parasites. This can be caused by, like I said, adrenal dysfunction, where you get fluid imbalances in the tissues, and it can affect any tissues. So adrenal dysfunction. So we look to find what that might be in terms of, if someone is dealing with tinnitus, and treat everything accordingly. And then we can usually see a difference in that. All right. Kathana asks, is it true, after taking thyroid medication for more than 10 years, the possibility of reversal is 0%? So I'm not exactly sure what she's talking about, a reversal of the low thyroid. Typically, low thyroid is caused by Hashimoto's 95% of the time, right? So if it's due to Hashimoto's, what we say is, can we get this into remission? Can we deal with all the triggers well enough that we can get this disease to go into remission, this autoimmune, so immune system disease, can we get it to go into remission? Okay. Think about this. If you're dealing with the actual root causes, don't you think the problem's going to be able to go away? Now, the damage that's done already to the thyroid isn't going to correct itself. The thyroid is not going to regenerate like the liver does. But would you be able to maybe utilize your thyroid replacement hormone better? I addressed that a little bit earlier. So yes, that's potentially and likely what can result when you do that. So from a medical standpoint, ladies, the possibility is zero because they don't have a treatment for this. They don't have a treatment for your immune system. This is what's been missed. This immune system problem has been severely neglected. So in that sense, the possibility is zero in traditional medicine. All right, next page. Robin asks, can Dr. Redd address women 60 or older and older that no longer have a thyroid? I have had radioactive iodine to destroy the thyroid decades ago. Should treatment for older women be different, especially when there's no thyroid? I am on Armour Thyroid and not optimal. So this is similar to the other question and the other, answer that I gave about having no thyroid, but I wanted to ask this because she's referring to women over 60. Doesn't matter how old you are. At whatever age you are, it really doesn't matter. What matters is we're getting to the root causes. This is why Marjo, and she's such a sweet patient, at 85 years old, has been able to reverse her issues, gain energy and strength back, and drop a lot of weight, and reverse her macular degeneration. Okay, she's over 60. Why wouldn't this work for you? All right, so there's really no special considerations. Just because you're in menopause doesn't mean that we can't help correct things that help your hormones work better and help your thyroid hormone work better, right? It just takes getting to the root causes. So that's pretty fun. All right, questions about weight. Patricia asks, hi, Dr. Redd, my thyroid runs fast and I take methimazole. Could this be why I can't keep my weight down? Well, methimazole is a drug that blocks thyroid hormone production. So can it go too far? Can hyperthyroidism be incorrectly diagnosed? It is all the time. Meaning your doctors will look at maybe more than the TSH, but maybe not. Maybe the TSH is really low. And they automatically assume, and you know what happens when you assume, that your thyroid is over-functioning. Okay? And when there's no real symptoms of hyperthyroidism, and they're basing this assumption off that one test that is not even a thyroid test. It is a brain test. And it tells you nothing about how thyroid hormone is functioning in your body. Only what's going on in the pituitary gland. So could you be misdiagnosed as hyperthyroid and be given this medication to block your thyroid production even more than it already is low? Absolutely. And this happens a lot, and I've seen it many times. So yes, it just makes her more hypothyroid. Pretty sad, huh? Vicky asks, why does my prescribed T4, T3 not help me lose the weight? Well, T4 and T3 typically are synthetic, and it doesn't always work in your tissues. Like I said before, many people do not do very well with these synthetic thyroid hormones, and so that's one reason. It just doesn't work in your cells. Another reason can be you've got a lot of other factors. Like I said, the Hashimoto's is the cause of the hypothyroidism. So just giving T4 and T3 isn't enough when the weight issue is due to something else. What if it's due to a blood sugar problem? Ladies, that's what the masterclass is all about. I share in there why blood sugar can be such an issue, insulin issues, blood sugar issues, which are kind of the same thing, are tied to weight gain almost every time. I think I gave a statistic like 99.9% of the time, if you have a weight issue, you have a blood sugar issue. And those of you who took advantage of downloading the free handout that I had for you, the dysglycemia panel and the optimal ranges for that, those markers, I explain that in there too. If you have a weight problem, you most likely have a blood sugar problem. And that needs to be solved other than just fixing the thyroid. Okay, you may have a thyroid problem too, but if you don't solve the blood sugar problem, you're not going to solve the weight problem. Lynn asks, how long before a meal should apple cider vinegar be taken? Right before you start eating. So dilute, I would say at least 2 teaspoons, maybe a tablespoon in 2 ounces of water. So take a shot glass and instead of shooting alcohol, shoot a little shot of apple cider vinegar and water right before you eat. Okay? Angela and Linda ask, how does apple cider vinegar help? How long before meals to take, which I just answered, and when to take if also taking liposomals before meals. Well, you take the liposomals 5-10 minutes before, and then you take this apple cider vinegar right before you eat your first bite. So apple cider vinegar helps to reduce the acidity. I should say, let's say this a different way. Helps promote more of an acidic environment in your stomach, which it needs to turn on the enzymes that you must have to digest proteins. And it also helps you to kind of hold off on digesting the fiber and the carbohydrates that you're consuming. So it delays that, and it helps you digest your proteins better so that you don't have as much undigested food going into your intestines, which then would cause more problems with inflammation, leaky gut, more insulin resistance, more autoimmunity, all that kind of thing. Okay, so that's why that's important, and that's how it helps. Is vinegar okay if you have a moderate hiatal hernia with GERD, gastroesophageal reflux disease? And it's not a disease. You guys, this is a symptom. GERD is not a disease. It is a symptom of too little stomach acid. And you bet, a little apple cider vinegar is absolutely fine when you have a moderate hiatal hernia if you are also treating that the right way. So maybe not, maybe kind of, let's back up. A moderate hiatal hernia, you need to have it assessed. You need to have it addressed. If medicine won't do anything about it, find a good chiropractor who can reduce it manually. Okay? Find a good chiropractor who reduces these hiatal hernias manually. And then then you can likely use apple cider vinegar just fine. Danny asks, is vinegar okay if you have toxic mold in your system? Well, absolutely. It is absolutely okay. All right. What do you think of carnivore diet with whole foods? I stopped most dairy and lots of veggies, and it seems to be helping. What are your thoughts? Diane and Connie asked this. It is very individual, Diane and Connie. So stopping dairy is key. That's part of the masterclass, part of the information I shared. Some people do have problems with certain vegetables, all right? So if you find that you're doing better without certain vegetables, then keep doing what you're doing. But I don't typically recommend a strict carnivore diet in only in select, very select cases. Okay. Sonia asks, Atkins is just keto. What's wrong with that? Well, Atkins promotes a lot more protein intake than we really need. Too much protein is going to cause inflammation. It's going to turn on what's called the mTOR pathway. MTOR, little m, capital T, capital O, capital R. This pathway promotes growth, okay? Promotes inflammation, promotes, like growth is in tumor growth. This is why too much protein, and this was found in the China study, to cause cancers, especially colon cancers, okay? Colon and liver. And so, even pancreatic. And so you don't want to eat too much protein. You want to eat enough, okay, but not too much. So keto isn't I'm not even saying keto is the best diet, right? I'm not going to say any diet's the best diet. It's got to be customized to you. And that's why our patients are successful, because they're guided, their coaches and providers guide them to customize their diet. That's the secret sauce. Okay. Darlene says, I have MS and sarcoidosis along with other issues, told to eat Mediterranean diet. So that sounds reasonable, but you still need to get rid of those 5 foods. So again, your diet really does need to be customized. Those are autoimmune conditions. You need to figure out what foods are trigger foods, all right? And food allergy testing is not always the most accurate, okay? And it's not. I don't even hardly use it. Dr. Redd said, Gloria asks, Dr. Redd said he doesn't test vegetarians or vegans because they don't heal and aren't successful in the program unless they eat meat for omega-3. Why is the omega-3 that is in nuts and seeds not adequate? Actually, I didn't say that. I said that you're not getting the correct amino acid profile that you need to make the proteins that your body needs, the enzymes and everything your body needs to heal when you're in a compromised state already. And so I found that those people, those vegetarians and vegans, just do not heal properly when they do not incorporate the right amounts of animal protein into their diet. Pam asks, do you work with pescatarians? Fish protein is helpful, yes, but you really do need to have a variety. It's possible to develop sensitivities if that's all you're going to eat, and you would have to be willing to eat fish protein for every meal, 3 meals a day. So you decide. Okay. Cheryl asks, how many meals per day work with this program? You got to have your 3 meals a day, maybe snacks too, because for most of you women with thyroid issues, blood sugar issues, intermittent fasting, meaning variable blood sugar, a lot of you have that, and hypoglycemic issues, intermittent fasting is not going to help. And it's going to be more stressful. So stress is related to weight gain. Stress is related to chronic degeneration because it promotes more cortisol production from your adrenals. And that's always going to raise your blood sugars, and you're going to have really a lot of trouble regulating that because, of the stress, the cortisol levels rising. Okay. Paula asks, how many carbs per day is needed? Truthfully, 0. You don't need, there's no requirement for carbohydrates. No requirement. There are essential amino acids and essential fatty acids. Those are the basic building blocks. Your body then creates glucose, produces glucose in 4 different ways without you even eating any carbs. All right. Now, there are some of us, we're going to say not necessarily nationalities, but races perhaps, that do a little better with some carbs, right? There's really not a number, though. There's not a specified number. That's why testing is important, to see your status, right? To see how you are in the blood sugar, insulin areas, okay? But there are no essential carbs. Okay, let me go to the next page. Now we're going to talk about drinks. Tiffany asks, distilled water or reverse osmosis, which would be best? So, truthfully, the purest water on the planet is distilled water. Now, we have this crazy notion that we have to get minerals in our water. We just have to. Why? What if we get minerals from other sources? Why do minerals have to come from our water? Have you ever thought of that? Like, distilled water is the purest, cleanest water there is. All it is H2O. It doesn't have anything else in it. No nasty stuff, no minerals, no pesticides, no toxins, no. It's pure. So, can you get your minerals in other ways? Absolutely. Should you? Yeah. You should eat regular meals. You should eat a lot of vegetables, which should have a lot of minerals. You should have enough animal protein, which you're going to get some minerals in there. But unfortunately, most of us do not get enough minerals from even the best diet that we can muster in this day and age. We still usually have to take a supplement, a good quality supplement with the right minerals. Okay. You can certainly distill your own water. There are in-home distillation systems. You can certainly buy it, but I would recommend get it out of that plastic as soon as you can. Okay. Store it in glass, and you'll be much better off. So, yeah, either way. All right. Michelle asks, is everyday dose coffee good to consume? I don't know about everyday dose coffee. I've never heard of it. I've seen a ton of ads for this coffee. I haven't seen a single ad for this coffee. I see ads for Life Boost. I personally drink Purity. A lot of times I'll have either the third calf or the decaf. Because it's mold free. These two brands are mycotoxin certified free, mycotoxin free certified. Okay, so I don't know about that brand of coffee. I'm sorry, Michelle. Diana and others ask, can I drink beer and other alcohol? Well, in case you didn't know, beer is made with barley, fermented barley, right? And this is, where you get a lot of carbs. And this affects your blood sugars. Those of you with weight issues should stay away from beer. Now, other alcohols, unless it's, sweetened with something, it's not as sugary. It's pretty much all that is fermented out, and there's just pure alcohol. But think about this, ladies. If you've got insulin resistance and you've got a weight issue, what's alcohol going to do to your liver? Is it going to help your liver? No, it's going to be a constant strain. I mean, a constant, depending on how much you drink. If it's just a very occasional thing, that's probably not going to hurt. But if you're doing some every day and you've got a liver issue, think about it. Is it a good thing? Okay. BJ asks, how much water daily? I recommend half your body weight in ounces every day. If you weigh more than 200 pounds or 220 pounds, I would say go up to about 110. I really don't think you need more than that. About 110 ounces every day, even if you weigh more than 210, 220. Okay. Liz asks, licorice tea is sweet. Is it okay? Well, I don't know. I've never really thought about that. The tea itself is probably fine. It's actually good for your stomach. I wouldn't see any problem with that unless you have an allergic reaction to it. Kelly asks, I must have missed something. Why is intermittent fasting okay if you have type 1 diabetes? I didn't say type 1 diabetes. I said type 2 diabetes. And it's generally because if you've gone that far, you're type 2 and you're type 2 diabetic, your blood sugar is high enough that intermittent fasting is probably not going to matter too much with that, depending on where you're at in that. Now, if you're at the stage where your blood sugars are not only high, but they're also really low, they go really low, and you're on insulin and all this, don't intermittent fast. Let's see, lost my place. Marzia asks, I didn't get why fasting is not helpful to low thyroid, please. And again, it's because, and I probably didn't make this point earlier, when you're fasting, this creates a stress. This is not something your brain really likes when you're not getting fuel. Now, I have had success with intermittent fasting for longer periods. Just keep in mind that the studies have been done on men. They really haven't done a whole lot of studies on women with this. So what I've noticed in practice, and I'm going to hang my hat on this because I've seen how it works or doesn't work, to incorporate intermittent fasting in women with hypothyroidism. Okay, this is typically a problem because when you're hypothyroid, you're hypometabolic, and you fast, and your brain's like, well, shoot, we got to have a backup plan. So I'm going to have to make sure she stores fat for that backup energy plan. Okay, that's why this matters. Lucille asks, why not organic cold-pressed seed oils? I think ridiculous that they are suddenly bad. The problem is the omega-6 content. And you need to make sure that your omega-3 to omega-6 ratio is good. You can get too much omega-6s, and that promotes inflammation. This is found in, probably in the recent, 5 years of research being done. Maybe a bit longer, but really kind of fleshing this out in the research, and that's why. That's why it's best to stick with, omega-3 sources rather than omega-6 sources. Okay, Pam asks, can you use lard from homegrown pasture-raised pigs? Yeah, that would be great. Susan asks, organic grass-fed butter. Well, butter still has some casein in it, and when you're struggling with getting the inflammation down, and casein has been part of the problem because of the dairy consumption, it's generally good to go without butter for while you're doing if you're in a program with us, probably better to go without, and then maybe introduce it again later on, and just use it once in a while, more sparingly. But yes, it's going to be better than not grass-fed butter for sure. Trina asks, ghee, is that considered a good fat? And ghee is better than butter because it's got a lot of it's got less casein. Almost all of the casein has been extracted from it, but not all the way. It's still got small amounts, so it is a little better. All right, so let's talk about some other food questions. Does zucchini count as a green veggie? Absolutely. Let's see. Is kale bad for you? Tiffany asks. No, kale's not bad for you. It's really nutrient dense. But would I eat it every day? No, no. You don't eat everything and anything every day. It is nutrient dense. I highly recommend it. So kale is good for you. Some people with oxalate issues, oxalic acid issues, this is usually found in a urine test. Kale may not be good for you because it is high in oxalates. All right. So it's very individualized. Once again, this success with this requires customization of your diet. Okay. Irma asks, but what animal foods are we talking about here? Grass-fed beef, lamb, or organic free-range poultry, so chicken, turkey. Wild game is great. So elk, bison, deer, right? Or grass-fed bison. It's usually not wild much anymore. Wild-caught fish, right? These are the meats. These are the protein sources that we really need to focus on. Okay? Dragana asks, D3K2 only works with vitamin A. Well, if you're getting, you will get enough vitamin A in your foods if you eat, the rainbow, right? If you have a good sense for eating the rainbow colors in your vegetables, you will typically get enough vitamin A from those vegetables. It does work better if you don't get a lot of those to take vitamin A. So Michelle asks, is the sweetener monk fruit okay because it's low glycemic? It's better than most, right? Now, if you have sugar cravings, one of the other questions I noticed, how do you stop sugar cravings? Well, ladies, you stop eating sugar or anything sweet for 2 weeks. It's really kind of that simple. Now, if you are really bad and thinking you're bad with those cravings and you're thinking you're just depriving yourself, don't do this without changing your mind first, right? Change your mind first. Get those false beliefs out of the way, right? Get that mindset right first. And then I think you'll have better success with this. Okay. Sandy and others have asked, so no fruit of any kind? No, ladies, that's not true. It just depends on what your tests show. So if your tests show high uric acid, problems with fatty liver, markers that show fatty liver, then probably fruit isn't the greatest to have all the time, and the kinds of fruit are going to matter, right? So there are certain fruits that are definitely lower fructose in concentration than other fruits. So we provide guidance for our patients with those. Just come to mind are, citrus fruits, lemon and limes. These are very, very low in fructose. Berries, certainly. So always eat organic berries because the skin is very thin. Those are lower fructose fruits, okay? But mangoes and pineapple and these are higher, right? Higher in fructose, so these may not be the best. Bananas, a whole banana, way too much fructose. So there were a lot of questions on grains and breads and sourdough breads. So sourdough is just where wheat has been, fermented until you're down to about 30% of the gluten that the wheat contains, and because that's what happens in the process of fermenting, it's still gluten, right? And what about gluten-free breads? Well, what are they made with? They're made from potato starch and rice flour, and so those aren't any good either. Those are just going to raise your blood sugar and raise your insulin levels. Okay, when your goal is to watch your weight, to release the weight. No, these gluten-free items are not good. I see a question, did he discuss protein smoothies? I'm going to answer that because that's a biggie for you guys, you gals. Smoothies, first of all, fruit smoothies. No, grinding that fruit up when you're trying to lose weight is going to be counterproductive for sure, because it basically releases the glucose quicker after, grinding it up, grinding those cell walls apart that the plants have, the fruit has. It's going to release that sugar and fruit sugar so much more quickly. It's going to be very glycemic, okay, to consume those. And then if you add protein powders, especially, I'm not a huge fan of the plant-based if you have problems with your gut or problems with insulin resistance. You're much better off with grass-fed beef broth or bone broth, and you don't see a whole lot of poultry-based bone broth powders. You might see some murine or fish-based protein powders, which are better, probably better. The problem is with a lot of these powders is you're going to get some heavy metal toxicity in some of these. So that's something to consider. And having some of this every day, you're going to get sensitive to these proteins, okay? This is not a good thing to have every day. You shouldn't eat the same foods every day, okay? You need to vary things up. Barbara asks about silver amalgam fillings. That's all she says. Silver amalgam fillings, question mark? Heavy metals. Every time you chew on them, they vaporize mercury. Half of that vapor is mercury. Every time. So, this can cause issues. This can accumulate in your body and in your blood. I think I'll do one more. We're at 7:50. I know we're a little late getting started, so I appreciate your patience in getting started, but I'm going to go with one more. So, can brain fog be due to taking certain medications? Yes, certain medications absolutely can cause brain fog. Blood pressure medications, beta blockers, calcium channel blockers, these can cause brain fog. Antidepressants can cause brain fog. Stimulants. I know that sounds funny, but it's when you stop taking them. Huge brain fog issues. So you get dependent on this. Even some people have brain fog with these stimulant issues. You notice memory issues. Even though you can pay attention, you can stay alert, you get brain fog, memory problems. Any drug that interferes with thyroid hormone conversion in the liver can cause brain fog. So I mentioned beta blockers. I didn't mention NSAIDs. So those are painkillers, pain relievers, and including acetaminophen, right? There are anti-seizure drugs that can cause brain fog, right? So these are often used for headaches, like topiramate, Topamax. There are multiple drugs that can cause brain fog. Ladies, I've answered a lot of questions. I really enjoyed tonight. Sorry we got started late. I will continue to answer some of the questions that you still have, that I still haven't answered, as I pop into the group. Try to do that most every day. Next week, we'll do a deep dive into Hashimoto's, so you don't want to miss that. So it's been a pleasure. I hope you guys all have a great evening, and remember, you still have the power to heal. Take care, everyone.